Hi, my name's Emily Garguilo. I work at our 10 Light Street location in the Under Armour Performance Center. I am a physical therapist and the clinic director here. Okay, so day in my life. Influencers make this look a lot easier than it is. I woke up, made my bed, washed my face, brushed my teeth. I got my coffee, obviously. I pride myself on like a 5 to 10 minute morning routine, and then I'm out the door. Right now, I'm commuting from Frederick, so it is a little bit of a drive, but really pretty sunrise on the way in, which is always nice to see. Today was a pretty chill day. I ended up working a little bit extra on Wednesday, so I only had 6 patients today. One really nice thing about working at the FX, we have one-on-one 45-minute sessions, so I'm able to kind of meet patients where they're at. A lot of my patients today were kind of at their end rehab, doing a little bit more generalized strength conditioning, that kind of stuff too. My first patient of the day, he's been coming to me for almost about a year now. He is an OG basketball player, so I always try to tie in some fun catches and throws and things like that. I had a little bit of a break, and then my 8:30 person, she was originally coming in for frozen shoulder for her right shoulder, and just recently started coming back for her knee and other shoulder. So I was kind of alternating between knee and shoulder exercises for her session. My next patient is coming in. She also was originally coming in for shoulder pain. She's having a little bit more discomfort with her hips. So we started by dry needling TFL area, posterior hip, glute med, and then followed it up with a ton of mobility because she was getting a little bit of that pinchiness at first. But as we were moving through those hip rotations, that started to feel a lot better. Third patient of the day, she actually had an ankle fracture, but she's been about 16 weeks or so since then. So she is feeling really, really well. She actually was having a lot of back pain today, so we did focus a little bit more on her back pain, and we treated her to the boots because happy Friday. Next person, she was coming in for kind of a whole smorgasbord of things, mostly been focusing on her right knee, but also having some right hip, right low back. We taped her knee because she's been having a lot of difficulty getting into terminal knee extension with walking, so that tape has kind of helped with tibial rotation. We also did some hands-on for her back, and at the very end, it worked on her mechanics of how she gets up and down off of the floor, because I want to make sure she remains independent with that. So I am the clinical director at 10 Light, so it just kind of entails a little bit more on the meeting side of things, which I honestly don't mind because it helps break my day up a little bit. Today I met with our physician liaison just to kind of chat about future upcoming doctor visits and referral trends. It's definitely a different kind of job when you're learning how to manage people, but super rewarding, and really nice that I had this opportunity so early on in my career. Last person of the day, he also started out coming to me for shoulder pain, since has been coming to me for a little bit more back pain. We had a really good session earlier in the week with dry needling. He actually looked a whole lot better today, so we were able to do pretty much the same session that we did earlier in the week and added a couple more mobility things, and then ended with some anti-rotation anterior core to help get those multifidi active. One really great thing about working here specifically at the Under Armour Performance Center, I can work out after work at this beautiful gym. It has a full turf, it has showers in the locker room, sauna, and just pretty much every amenity that you could think of. So after I get a good workout session in, I just drive home and I'm ready to go. It was a really good day, flew by, and I was done by 2 p.m. And that's a day in the life of a physical therapist / clinical director.